Hi, this is Mike McCabe. The story shared by Dr. Hoong-Dang Vu says so much about our healthcare system, what's wrong with it, but also how it could be made so much better. And the story she tells of a woman who was without health insurance and finally was able to become eligible for Medicaid, and then she got cervical cancer screening and was found to have cervical cancer, but it was caught early enough so she was successfully treated. That's something that hits really close to home, not just because my family kept our farm profitable by foregoing health insurance, so I wasn't insured until I was 22 years old, but also because I had a sister whose life was cut short by cervical cancer. So when she tells this story, it does hit really close to home, and it says so much about what we could do to make healthcare more accessible, more affordable, and so much better, both in Wisconsin and across the country. Now, in the end, I want to see our country have a single-payer Medicare for all system nationally. But I'm not running for Congress, I'm not running for president, I'm running for governor, so I want to focus on how Wisconsin can become a national leader, a model for the nation to follow when it comes to healthcare. We've got the Badger Care program, but remarkably few people are eligible. It's for low-income and disabled people only. And you know that's something that we could correct. And I think 3 steps have to be taken. First of all, we should correct the mistake that was made when our state refused Medicaid expansion money. We should take that Medicaid expansion money from the federal government. That could make more than 84,000 people eligible for Badger Care. We could get them covered and get them the kind of preventive and medical care that they need. The second mistake that we should correct, that Wisconsin also made, was neglecting to set up a state health insurance exchange under the Affordable Care Act. We should set up that insurance exchange. Then we should take a third step, and that's making Badger Care a public option that would be put on that insurance exchange and would be open for anyone to choose. We should let anyone in Wisconsin enroll in Badger Care if that's the insurance that's best for them. And I strongly believe that Badger Care should be there for all Badgers. And we can do that. We can make Badger Care a public option. We can put it on a health insurance exchange that we set up for the state of Wisconsin. And of course, we can make Badger Care available for more people by taking that federal money and leveraging that money to expand eligibility. We do those 3 things, and Wisconsin can be a national leader. We can be a model for the nation to follow, and we can set the stage for the kind of national healthcare system that we really need to get to eventually in this country. We can provide that leadership.